Patricia came to my office crying, 71 years old from Boston. She'd spent $4,000 over 18 months on circulation supplements.
$4,000? On vitamins alone?
Vitamin E, horse chestnut extract, Ginkgo biloba, L-Arginine, and high-dose niacin. The full American buffet of circulation promises.
And I assume none of it worked?
Worse than that. Her legs actually got worse. The swelling increased. New varicose veins appeared that weren't there before.
How is that even possible? If the supplements didn't help, they should at least be neutral.
That's what she thought too. But here's what nobody told her. Horse chestnut can increase bleeding risk when combined with her blood thinner medication.
Wait, her doctor didn't check for interactions?
Her doctor didn't even know she was taking supplements. She bought them all online after watching YouTube videos promising miracle cures.
This is exactly what I've been saying for years. Americans treat supplements like candy. No medical supervision, no blood work, just hope in a bottle.
Hold on. This isn't a supplement failure, Akira. This is a knowledge failure. The right vitamins, properly dosed and monitored, absolutely can improve circulation.
Show me one patient who reversed peripheral artery disease with vitamins alone. Just one.
I'm not claiming they work alone, but they create the physiological foundation that makes movement possible. Some patients can't walk because the pain is unbearable.
Then we start with aquatic therapy. Movement in water reduces joint stress. Still, no pills required.
And how much does aquatic therapy cost per session? $150? $200? Most insurance doesn't cover it.
You have a point there, but walking is free.
Walking is free for people who can walk. Patricia couldn't make it to her mailbox without stopping 3 times from cramping pain.
Okay, so what did you actually do for her?
First, I stopped all 5 supplements immediately. Then I ran a complete metabolic panel, checked her inflammation markers, and tested for vitamin deficiencies.
And what did you find?
Her vitamin K2 was critically low. D3 was at 18 nanograms per milliliter, which is severely deficient. And her homocysteine was through the roof at 22.
Homocysteine that high means vascular inflammation. That's dangerous.
Exactly. So I started her on a targeted protocol, not random supplements from the internet, specific doses based on her blood work and medication list.
What protocol specifically?
Vitamin K2 at 180 micrograms daily with a meal. D3 at 5,000 IU until her levels normalized. And methylated B-complex to lower that homocysteine.
But you also made her walk, didn't you?
Of course. But here's the key. After 6 weeks on the vitamin protocol, her pain decreased enough that she could actually walk 10 minutes without stopping.
So the vitamins gave her the capacity to move, and the movement improved circulation further.
Precisely. It's not either or. It's both. The vitamins created the biochemical environment. The movement activated the mechanical pump in her legs.
I can accept that. But my concern is people will hear this and think they can fix everything with supplements alone.
Which is why we need to be very clear about what works and what's complete garbage. Most circulation supplements are worthless.
Including the ones Patricia wasted $4,000 on?
Especially those. Let me break down why each one failed her and what actually has evidence behind it.
Start with vitamin E. That's the most popular circulation supplement in America.
Vitamin E for circulation is based on outdated science from the 1980s. Multiple large studies since then have shown no benefit for peripheral blood flow.
But people still buy it because the supplement industry keeps marketing it.
Correct. And worse, high-dose vitamin E can interfere with blood clotting. Patricia was on warfarin. That combination is genuinely dangerous.
In Japan, we rarely supplement vitamin E. We get it naturally from sesame seeds, green tea, and vegetables.
Much safer approach. Food gives you 15 to 20 milligrams. Supplements can be 200 to 400 IU, which is excessive.
What about Ginkgo biloba? I know it's popular in traditional Asian medicine, but does it actually help leg circulation?
Ginkgo has some cognitive benefits: memory, focus, possibly dementia prevention. But for peripheral artery disease, the evidence is weak at best.
We tested it extensively at Kyoto University. Large randomized trial. Over 300 patients with claudication pain.
What were the results?
Minimal effect. Some patients reported maybe 10% improvement in walking distance, but most showed no measurable change in ankle brachial index.
So Patricia spent $1,200 over 18 months on Ginkgo, for essentially nothing.
This is why I get frustrated with supplement culture. Companies prey on desperate people with promises they can't deliver.
I share your frustration, but it makes me want to educate people on what actually works, rather than dismissing all supplements entirely.
Fair enough. So what does work? You mentioned vitamin K2, D3, and B-Complex. Why those three specifically?
Let's start with K2, because this one is critical and almost nobody knows about it. Vitamin K2 directs calcium into your bones and out of your arteries.
You mean it prevents arterial calcification?
Exactly. When you're deficient in K2, calcium deposits build up in your vessel walls. That's called vascular calcification, and it's a major cause of poor circulation.
And most people over 60 are deficient in K2?
Most Americans are, because K2 comes from fermented foods like natto, which is common in Japan, but almost never eaten in the United States.
Natto is one of the reasons elderly Japanese people have much lower rates of arterial calcification than elderly Americans.
Agreed. A 2018 study in the Journal of Nutrition found that people who ate natto regularly had significantly more flexible arteries.
But Americans won't eat natto. The texture is too unfamiliar.
Which is why supplementation makes sense in this case. 180 micrograms of K2 daily can replicate the vascular benefits without having to eat fermented soybeans.
Okay, I'll give you that one. K2 has real evidence. What about vitamin D?
Vitamin D deficiency is epidemic in people over 60, especially those with circulation problems. Low D3 levels correlate strongly with endothelial dysfunction.
Endothelial dysfunction means the inner lining of blood vessels can't dilate properly.
Right. When your D3 is below 30 nanograms per milliliter, your vessels lose their ability to expand when you need increased blood flow.
And that's exactly what causes the cramping pain during walking.
Exactly. Patricia's D3 was at 18, severely deficient. No wonder her legs were screaming during any physical activity.
But can't you just get vitamin D from sunlight? Why do Americans always need supplements?
Because most people over 60 don't synthesize vitamin D efficiently anymore. The skin's ability to produce D3 from sunlight decreases significantly with age.
In Okinawa, elderly people spend much more time outdoors than Americans. They're not sitting inside watching television all day.
That's a cultural advantage. But for someone in Boston who's homebound because of leg pain, supplementation is the practical solution.
All right. What's the proper dose of D3 for someone with circulation problems?
If you're deficient like Patricia, start with 5,000 IU daily. Retest after 3 months. Once you're above 40 nanograms per milliliter, you can drop to 2,000 IU maintenance.
And always take it with a meal that contains fat, because it's fat-soluble.
Exactly. Now let's talk about the third one, B vitamins, specifically the methylated forms.
This is about lowering homocysteine, right?
Yes. Homocysteine is an amino acid that, when elevated, directly damages the lining of your blood vessels. It's like sandpaper scraping your arteries from the inside.
And Patricia's homocysteine was 22. What's normal?
Optimal is below 10. Acceptable is 10 to 15. Anything above 15 is concerning. Above 20 is actively dangerous.
So her blood vessels were being damaged constantly by elevated homocysteine, and nobody caught it until you tested her.
Correct. Most doctors don't routinely test homocysteine, which is a mistake in my opinion. It's one of the best predictors of vascular disease.
And B vitamins lower homocysteine how exactly?
3 B vitamins work together. B6, B9, which is folate, and B12. They convert homocysteine into other harmless compounds through a process called methylation.
But you specifically said methylated forms. Why does that matter?
About 40% of people have a genetic variation called MTHFR mutation. It means they can't efficiently convert synthetic folic acid into the active form.
So giving them regular folic acid is useless?
Worse than useless. It can actually block the receptors and make the deficiency worse. That's why I always use methylfolate, methylcobalamin, and pyridoxal 5-phosphate.
Those are the active forms that bypass the genetic bottleneck.
Exactly. Patricia started on a methylated B-complex. Within 8 weeks, her homocysteine dropped from 22 to 11.
That's a dramatic improvement. Did she notice a difference in symptoms?
She said the burning sensation in her feet decreased significantly. The cramping still happened, but it took longer to start during walking.
So the vascular damage was healing. But she still needed movement therapy.
Absolutely. The vitamins created the biological conditions for healing, but walking is what actually rebuilt the collateral circulation.
Collateral circulation is when your body creates new, small blood vessels to bypass blocked arteries.
Right. And that process only happens when you stress the system through repeated walking. The body adapts by growing new pathways.
This is what I've been trying to explain. Movement is not optional. It's the primary treatment.
I agree. But for someone like Patricia who couldn't move because of pain, the vitamins were the bridge that made movement possible.
Okay, so we're not disagreeing on the fundamentals. Vitamins prepare the body. Movement rebuilds the system.
Exactly. Now let me address the other supplements Patricia was taking, because people need to know what to avoid.
You mentioned horse chestnut earlier. Why is that one problematic?
Horse chestnut contains a compound called Niacin that's supposed to strengthen vein walls, and in some studies, it shows mild benefit for varicose veins. But it also has blood-thinning properties. If you're already on warfarin, Plavix, or even aspirin, combining them can cause dangerous bleeding.
And Patricia was on warfarin, so taking horse chestnut was actively harming her.
Correct. She developed easy bruising and had a nosebleed that wouldn't stop. That's when her primary doctor finally caught the interaction.
This is exactly why I'm skeptical of supplements. Too many interactions, too little supervision.
Which is why proper medical guidance is essential. You can't just buy random supplements online and hope for the best.
What about L-Arginine? I see that marketed heavily for circulation and erectile function.
L-Arginine is an amino acid that's supposed to boost nitric oxide production. Nitric oxide helps blood vessels dilate.
Supposed to, but does it actually work?
The problem with L-Arginine is that most of it gets broken down in the gut before reaching the bloodstream. Bioavailability is terrible.
So you're taking 5 grams of arginine, but only absorbing maybe 10%?
Less than that. And even the amount that does get absorbed doesn't significantly raise nitric oxide levels in most people.
Then why do companies keep selling it?
Because there's one small study from 2005 that showed modest improvement in walking distance. But multiple follow-up studies failed to replicate those results.
So the evidence is weak at best.
Very weak. And Patricia was spending $60 a month on pharmaceutical-grade L-Arginine for no benefit.
What about citrulline? I've heard that's more effective than arginine.
You're right. L-citrulline actually has better evidence than L-Arginine because it's converted to arginine in the kidneys, bypassing gut breakdown.
So if someone insists on trying an amino acid for circulation, citrulline is the smarter choice?
Yes. 6 grams of citrulline daily has been shown to improve walking distance in people with peripheral artery disease. Not a miracle cure, but measurable benefit.
But you didn't give it to Patricia. Why not?
Because her primary issues were vitamin deficiency and vascular inflammation. Citrulline wouldn't address those root causes.
You treated the foundation first, then considered additional support.
Exactly. There's no point optimizing nitric oxide if your vessels are calcified and inflamed.
What was the last supplement Patricia was taking? You mentioned 5 total.
High-dose niacin, 500 milligrams twice daily. She read online that niacin improves circulation by dilating blood vessels.
And does it?
Niacin does cause a flushing effect, where your skin turns red and warm. But that's histamine release, not improved circulation to your legs.
So people feel the flush and think it's working, but it's just a side effect?
Correct. And high-dose niacin can cause liver damage, especially in older adults taking multiple medications.
Did Patricia have liver problems from the niacin?
Her liver enzymes were elevated, not dangerously high, but definitely trending the wrong direction. We stopped the niacin immediately.
So, to summarize for people watching, she was taking 5 supplements. None of them addressed her actual deficiencies. Some were causing harm.
Exactly. $4,000 wasted. 18 months of suffering. All because she didn't get proper testing first.
This is why I advocate for lifestyle first. You can't supplement your way out of a sedentary life.
Agreed. But you also can't walk your way out of severe nutritional deficiencies. Patricia needed both.
Fair point. So, what's the practical takeaway for someone watching this who has leg circulation problems?
Step 1. Get tested. Don't guess. A complete metabolic panel, vitamin D, homocysteine, and inflammatory markers.
Step 2. Stop all supplements until you know what you actually need. Throwing random pills at the problem makes things worse.
Step 3. If testing reveals deficiencies in K2, D3, or B vitamins, address those with targeted supplementation.
Step 4. Start walking, even 5 minutes daily. Increase gradually as your capacity improves.
And step 5. Work with a doctor who understands both nutrition and vascular disease. Don't try to treat this alone based on internet advice.
Because Patricia's story could have ended much worse. Bleeding complications from the horse chestnut, liver damage from the niacin. She was lucky.